Hi, welcome to the NICU. The NICU can be a frightening experience for families. Your baby is here and you're separated from them. But there is one thing that mothers can do to truly help their babies in the NICU and beyond. In the NICU, we have 3 lactation consultants, Britt, Robin, and Susan, that's me, and we will help you to pump to provide milk for your baby. We also have nurses who are trained in lactation and in helping moms to pump. So if you have questions, you have lots of resources. So when you pump, you need to do that every 2 to 3 hours. Babies eat every 2 to 3 hours, so moms need to pump every 2 to 3 hours, even at night, even in the middle of the night. Actually, that middle of the night pumping is probably one of the most important ones because it sets the pace for your milk production for the next day. So our guidelines for pumping are always wash your hands first, pump every 2 to 3 hours. You want to save all of your milk. You want to label your milk with the labels we'll give you. And we have these labels that have your name and your baby's medical record number, and you'll put the date and time you pump, AM or PM. These go on the side of the bottles. And then we have colostrum numbers for the very first times that you pump. The first 20 times you get breast milk, you will put a number on the lid. And that way we will give the colostrum, your first breast milk, in the order that your body makes it. The other thing you need to do is wash your pump parts each time. If you don't express any milk, you can throw the bottles away and we will give you fresh ones for each pumping. But you do need to wash your pump parts each time. You also need to seam sanitize your pump parts once a day in the bag that we will give you. So what can you do to help your milk supply? The biggest thing you can do is pumping every 2 to 3 hours. But also you can do skin-to-skin holding with your baby. You hold your baby on your chest, and your baby only has a diaper on, and he's on your bare chest in between the breast, and you put a blanket on over, and that will help soothe your baby, helps regulate his heart rate, helps regulate breathing and blood sugar, and it helps mom's milk supply very, very much. So that is something that moms can do. Dads can do it too, but really it's best if moms do it the first day or two. So, dads, speaking of you, we need you here. We want you in the NICU to see your baby. Your partner needs you to be a support. Your baby needs you. And you can do many things to help your partner through this journey. You can wash the pump parts for her, dry them, reassemble them so they're ready for the next time. You can use a baby tracker app on your cell phone to help track your baby's weight and milk production. That's a lot of fun because it kind of gets competitive. As mom pumps and gets more milk, the more milk she makes and the more she expresses, the more she's going to make the next day. So it's very, very helpful. And just being a loving, supportive person for your partner is very, very important. So there are other things you can do, and one is watching this video for massage and hand expression of your breast. And if you need help after you see the video, you can certainly ask your lactation consultants for help and we'll show you how. Okay, so I want to explain to you one thing. Pumping early and often and every 2 to 3 hours is very, very important. If a mom's breasts get super engorged and she is in pain, that engorgement is a cellular message to the milk-making cells to stop making milk. And so once she gets very engorged and hasn't pumped for a long time, the milk starts to dry up. And I'll give you an example. We had a mom who started pumping, and in the beginning, she was only getting drops. And after a few days, she was getting 10 mLs, 15 mLs. That's half an ounce. And then by 3 to 4 days, she was making over an ounce from each side, which was wonderful, more than her baby needed. And then her baby shower came. And she went to her shower, and she was so excited to see her friends and family. And she didn't pump for over 6 hours. And that night, she pumped, and she got more than she had ever gotten. And she thought, oh, this is fine. I can miss a pumping. It's okay. So then she slept through the night. So basically, she missed 6 hours worth of pumpings during the day and 6 hours worth of pumpings that night. And then her supply went down to 5 to 10 mLs. It didn't matter how many times she pumped. It didn't matter what medications she might have taken. She could not get her milk supply back. So I want to encourage you to please, when you pump, try to pump every 2 to 3 hours, save all of your milk, bring it to the NICU, and your baby will be better off for it. As you can see, there are so many things to learn about the NICU and pumping and later on breastfeeding. We are here to help you. If you have any questions or concerns, if you need anything, or you just don't understand, please ask to see one of the lactation consultants. Thanks for watching, and we'll see you in the NICU.